Good afternoon, everybody. My name is Caroline Colas. I'm the Senior Director of Health and Wellness at the Marlene Meyerson JCC Manhattan. It is my pleasure to welcome you to our Lunch and Learn call, a series that we are conducting with the Whole Being Institute. Today, my guest is Gary Redfeather Keil, and we're going to be talking about holistic resiliency. Many of us struggle to live lives of holistic health and thriving because we lack the awareness of how deeply the mind and body are interconnected. We often dictate massive amounts of energy or dedicate massive amounts of energy and time strengthening one at the expense of the other. Gary Redfeather will discuss how we can live fully only when we cultivate every aspect of life openly and completely and employ a because of and not despite mindset around the inevitable traumas we encounter. A little bit about Gary. He runs the postgraduate clinical leadership education and research program at the De Montfort University in Leicester, England, as well as numerous leader development programs in the US. Gary's teaching, research, and professional practices weave a deep understanding of neuroplasticity, which is the rewiring of the brain and the nervous system, into the development of chronic pain and post-traumatic states, holistic wellness therapies, medical, mindfulness, and nutrition, as well as organizational development and helping individuals and organizations increase their chances of a future. So that's called post-traumatic growth order versus post-traumatic stress disorder. He's an Ironman triathlete. Gary was inspired by Tal Ben-Shahar to see how far he could cultivate his mind-body resiliency, leading to multiple ultramarathons, including a COVID-19 lockdown virtual version of the John O'Groats to Land's End 825-mile run, which sounds unbelievably hard. Welcome to the call, Gary. Thank you so much for being here.
Oh, Caroline, thank you so much. I'm so happy to be here. Yes, and as you can tell from my accent, I am deeply British. Not at all. From the state of Wyoming originally. So I'm a boy from the Rockies, but living in, it's actually pronounced Leicester,
Thank you.
which is the English pronunciations you got to get used to. So anyway, I'm super happy to be here.
Yeah, and what time of night is it for you there?
Oh, it's almost gin time. I mean, it's almost dinner time, 5 o'clock.
We were joking. I was saying, I think I'm going to be pretending my tea is a cocktail.
Is
right?
it? Yes.
Yeah.
It's always 5 o'clock somewhere, and it is right
Yes,
here. So.
That's true. Awesome. Well, we have much to talk about. But first, how did you get involved in positive psychology?
Yeah.
I mean, your background, it doesn't necessarily lend itself to an exploration of positive psychology.
Yeah. So originally, so I'm a pharmacist by training. When I was doing my pharmacy degree, I worked at a VA hospital in Wyoming and noticed that about 80% of the women and men who were part of the system were dealing with some kind of pain episode, be it an episodic pain every once in a while or an outright chronic pain. As a pharmacist, I was trying to treat them aggressively to, alleviate their suffering. And I found out that I could help about 50%. Who were either misdiagnosed or they weren't being treated well, but 50% remained untreatable. And so that led me to go get my PhD. So I have a PhD in neuropharmacology, which basically is just how the medications work in the nervous system. Then I supplemented that with a postdoctoral fellowship in electrophysiology. And that's where I started looking into the neuroplastic changes that happen in chronic pain states. Because, and we'll talk about this a little bit, pain is something that is absolutely paramount to our lives. And so our ability to kind of get into pain states are wonderfully designed in our body. Now that's also the downside. So anyway, advancing through my career, I kept noticing the power of the mind-body connection when we go to treat somebody in, say, a chronic pain state. I was also looking at holistic wellness approaches like the yoga practice that I was doing, like the meditation and mindfulness-based stress reduction practices that I was doing. And I thought I needed to kind of weave together these into a holistic wellness center, which I did. And so if you can imagine, I was a pharmacist for a couple of years wearing flip-flops in the front of a water wall who would counsel patients for about 90 minutes at a session, and if things got too heavy, we would go into the yoga studio to do mindfulness-based stress reduction, and it worked beautifully. So combining physical approaches with mental approaches, with medical approaches, and nutritional approaches was something that enabled me to help people, not just in the Philadelphia area, which is where I was from, but globally. And that kind of took me into really the positive psychology realm, where I was very fortunate enough to be in the very first cohort of the SIP program at Kripalu, where I met Phoebe. Phoebe and I then went and were together TAs for TAL the second year of the program, which was a phenomenal experience. And that simply just started me down the route of really embracing not just holistic wellness for an individual, on an individual place, but how disease and health are actually paralleled in organizations like the NHS here in the UK. We are all privy to and burdened by our own fears, our own biases, and our own unconscious mechanisms, just like organizations are. Matter of fact, organizations suffer or thrive because the wellness of their individuals is either good or not. And so that's what I do now, is I just simply help cultivate this awareness within the NHS, which is a pleasure because it's the fifth largest non-military business or organization employer worldwide.
Wow.
And so I get to influence that. So that's so actually positive psychology is another medicine in the toolbox that I have, just like exercise, just like medicine, just like relaxation. So I bring it all together.
Yeah, I feel the same way. And in fact, one of the about it being another tool, or I'm learning that it is another tool.
Mm,
And I wonder where to start today. I mean, I feel like we could start with both the personal and
mm,
then go to the professional, meaning like, how do you actually use this in your life? Or
absolutely.
knowing, I always find it fascinating when somebody like yourself, who really has such a breadth of knowledge and has worked worldwide, right? To go like really small and say, okay, you have all this knowledge. How does that influence how you live and what you do?
Mm,
And then move from there, kind of like starting from the cellular and moving out.
absolutely. So in my realm, there's a saying that leadership cannot be taught. Period. It cannot be taught. It has to be learned. And so what I would like to offer up is to start, this conversation is really to start deeply, intensely personal for everyone on the call. And so I know it's lunchtime, but I'm going to ask people to do a closed eye guided meditation. Hopefully nobody's driving listening to this. If you are, don't close your eyes fully, but is that okay? Can I actually do a guided meditation for folks?
Absolutely.
Okay. So if everyone would find themselves in a relatively comfortable position and just listen to my voice and close your eyes, just take a couple deep breaths and appreciate being safe, sound, warm in this moment. Don't care about anything else, because you are. You're safe, you're secure, you're perfectly fine in this moment. Now, with your eyes closed, I want you to imagine that you're walking along a familiar stretch of landscape that is very peaceful to you. It can be a path, it can be a road, it can be your garden. You feel the warmth of the sun on your face and the slight breeze blowing across your skin. You hear the lulling sounds of birds, a stream, or any other melody that puts your heart completely at rest. You breathe in the clean, fresh air, and you soak in how wonderful life is in this moment. Life indeed is grand. You breathe in deeply. As you feel your chest expand, you feel something on the front of your shirt that you'd not noticed before. So you look down. Ooh, odd, you think? This looks like a runner's bib. The bizarre set of numbers and letters that are not part of your choice wardrobe selection. For you, you didn't choose to put this on this morning. You're not even a runner, so why would you have this on? Well, looking beyond the bib and down to the ground, you see a solid white chalk line in front of your feet with the word start written on the other side. You hear noises you're unaccustomed to that draw your attention upward to a rather grim but very official looking official with a gun raised above his head. Whoa, wait a second, you start to think. You begin to say this as he yells loudly, drowning out any protest you might have. Runners set, and bam! An explosion of noise shatters any peace of mind you had previously. The physical shock, though, is quickly and excessively overshadowed by the mental and emotional wave that nearly knocks you to the ground. The nausea is palpable and crippling as you've never felt it because you haven't chosen to be in this supposed race. You don't even know what the race is. You're not too sure what you're doing. You don't even know how long it's going to be. You haven't prepared for it, and you're unsure how, if you have the right equipment, let alone the equipment you'll need to finish. You have no map. All of your protests don't matter. You are in this race now. You realize on a deep, deep level that you must go forward. The bib is now tattooed on your skin like the mark of a branded and captured person. You are no longer the you of your past with the life you had just a few seconds ago. You feel stuck because you know you can't not go. Yet you feel you can't go because you're not prepared. You're a good person. So why is this happening to you? So I'd ask you to open up your eyes now. Come back to this moment and replace the mental image of a run. I call it the cosmic starter's gun, with a cancer diagnosis, with the admission of your spouse that they've been cheating on you, the loss of a job, the death of a child. How many of us have ever just kind of bopped along in life, having a what I call a blessed, cursed life, where everything is fine, only to have something like that happen? In a moment, our life changes and we feel completely unprepared. So here's where I start, and the reason why I start this is because there's a reality out there that it's not a question of if trauma is going to happen in our life, it's when. And so if it's not a question of it happening, how many of us feel well prepared to do a 100-mile run? Anyone on the line feel prepared?
Let's
Guess
check out
what?
the gallery. Let's see if
Can we
anybody
look at the gallery?
does.
Anyone
Anybody
prepared to do
raising
a
their hand?
100-mile run?
Okay,
Okay,
you're
well,
with me. You're on my side.
a
We're not
100-mile,
prepared.
yes, a 100-mile run is actually easier than some of the other stuff I listed. Now, here's where all of this comes together. And the reason why I start here is because we live these blessed, cursed lives. And I do call them that. And if we have a life that's pretty good, that we're just kind of going along and not having any major traumas happen, do you think we're preparing ourselves for the eventual trauma that's going to happen?
No.
Yeah, the answer is no. So when the trauma happens, and this is where the science behind things like PTSD come into play, when we live these lives not cultivating ourselves, and there's a very important connection here between the mind and the body, but when we live these lives where we're not cultivating that particular potential, which is going to happen, when it happens, we don't have the internal or external resources to weather the storm, to get us through. And that's what creates post-traumatic stress disorder. Okay, I like to think of this as most of us are bopping along kind of relatively happy. We have good days and kind of bad days and whatever it is, but we're kind of wavering along a background of okay. We're all okay. Well, when a trauma happens, it deviates our life in an instant to something that's not okay. That's called a post-traumatic state. PTSD is the state where we cannot get back out of it. We don't see how. We don't have the resources within us and around us, and there's always both. But we don't see it. We can't do it. We have no skills ready to do. We don't have the medicines. We don't have the tools. And so we stay in that state completely shell-shocked and we never recover. There's a lot of people in this world who are in that state right now. Now there's another state that we can cultivate that is called post-traumatic growth. And so post-traumatic growth order is we're bopping along the same way around that baseline. The trauma happens and we go into a post-traumatic state. We can't not go into it by definition. But what we do is like the phoenix rising, we start to look at our life and go, you know what? It doesn't really matter if I don't have lipstick on. It doesn't matter if I have COVID locks and my hair's all over the place. It doesn't matter if, and we start to see these petty things that we thought were so important is really not part of our happiness, our life. The trauma is like a crucible moment that some of us in positive psychology have heard about. It's the thing that we get thrust into. It actually burns that stuff away so that we don't have that baggage anymore. We don't have the stuff that weighs us down. We start to see life as light and free and you know what? Pretty nice. And we don't just go back up to our baseline. We go way past it because that baseline was actually not thriving anyway. It was okay, but it's not really where we could be. And so my approach to all of this is based on these findings that people who go into these post-traumatic growth states are the people who can cultivate the skill sets, the mindsets, and all of this other stuff so that when that trauma happens, it's actually a godsend. That's the potential. And so that's the start of, I think, a very long conversation saying, okay, how many of us feel prepared to weather this pandemic in that beautiful way where we start to look at life as wonderful amidst the pandemic, not despite it, but because of it. Probably a lot of people are like, I don't see it quite yet. And it's like, okay, this is where neuroplasticity comes in. This is where the retraining of the brain starts to come into play because it may be simple and it may actually even be natural, but that doesn't mean it's easy. Doesn't mean, I mean, it doesn't mean it's short. It's, you know, there's a lot of things that we can start to unpack. So the reason why I start to bring this up is people really have a visceral response. And I see in the chat function, I do disagree with this premise. And I'm like, that's beautiful because people deal with trauma in all sorts of ways. Absolutely true. How many people deal with it well and how many people deal with it not so well? What are the things that help evaluate or allow people to deal with it well?
Yeah, I want to ask
Yeah.
a different way. So
Yeah.
my kind of understanding is that sometimes these traumas actually create this realization
Hmm.
and they create this journey. In other words, but what you're suggesting is that we recognize that there's a journey in which I can create my resilience or create a relationship to trauma before it happens so that I'm
You
ready
can.
for it.
Yes. Yeah. So
So
that's just it is. Yeah.
I have heard, of course, I work with people living with Parkinson's and cancer, and I have
Mhm.
heard of people saying, you know, I found a strength from within. I look at life completely different. But you're the first person that I've heard of that says, you know what, that's part of our biology, or that's part of the way that we can actually prepare ourselves for.
Yeah.
We can actually utilize that
Yes.
and then
Yeah.
be able to look at this pandemic in a
Yes.
completely different way or have a
Yeah.
different relationship. Am I on to something?
No, you're
Is that what
absolutely.
you're
Yeah.
talking about?
Yes, and I think this might help maybe fill in a little bit of the gaps because I'm reading some of the comments and it says PTSD develops when trauma isn't dealt with, and that's partially true, and I agree with that. It's also what happens when it's dealt with in unhelpful ways. So just by dealing with a trauma doesn't mean we're going to get through the trauma. Matter of fact, dealing with the trauma in bad ways can keep us in the traumatic state. It's like exercise. Is all exercise good? And the answer is no.
No.
Matter of fact, anyone who starts a New Year's resolution, I want to go to the gym 5 days a week. When you start that on the backdrop of nothing, the body tells you very quickly, you're stupid. It doesn't like what you're doing and it will tell you. And you'll be like everyone else, 19 out of 20 New Year's resolutions fail before Valentine's Day. We know that from based on studies. And it's because we tend to do things in the incorrect ways at the wrong pace not really looking at our resources, if you will, before we start acting. Okay. But what you're getting on, I think, Caroline, is absolutely beautiful, because what we can do is we can take the system and recognize that we are hardwired to focus on the threats that kill us, not the good things that make us feel warm and fuzzy. And there's a reason for that. And I just simply ask, do you think it's better to jump 100 times at a moving reed on the savannah than get eaten by the tiger the one time that you don't? It's better to overjump, 100 times, because they could have been that tiger, right? The threats to our survival are so hardwired into us, they actually develop a memory on a subconscious level. And I'll just unpack that a little bit more, because chronic pain is my research. When we have a pain that comes into our system again and again and again, and it's usually longer than 3 hours, not 3 months, our nervous system starts to adapt. The reason why it does that is because pain is the most important sensory system that keeps us alive. We can be stricken blind, we can be stricken deaf, we can stop smelling, we can stop tasting, it doesn't matter. But if you're born with something called congenital insensitivity with pain, which there are people who are, you don't have the ability to react to threats or potential threats to your body. These people die horrendous deaths usually before they're 13. They literally walk their feet into the ground, they get gangrene, and they die horrendous deaths because they can't feel pain. So pain is the most important physiological phenomenon we have that keeps us alive. It's a lens that overrides everything, because that's a threat to our existence, okay? It's so important, it overrides everything. And so when we're feeling a pain or there's a potential threat to our existence, everything else goes offline. So we were kind of joking earlier on about the neocortex. The neocortex completely shuts down, as it should. We don't need to think through things, we need to survive. And so our subconscious memory develops, and we don't even know it because it's subconscious. Well, when the pain or threat resolves, we go back to living life and we think that everything is perfectly fine. We are absolutely rewired and triggered by anything later on. And so it's very similar to a song that we hear 30 years later and we immediately start, kick in and we start singing it. There's a pain memory trace that is triggerable when the pain source is long gone. And so people who go into chronic pain states kind of with no cause just simply don't realize that there was a cause. It could have been decades ago.
Is it like we have, like on our computer, these little open windows
Yeah.
that stay open,
Yeah.
And that what you're suggesting, can meditation or can anything close those windows, or do we even want to close those windows?
So here's where some of the questions I think are absolutely beautiful questions. And so things like, do we ever want to close the window? Well, the answer is we can't fully, but we wouldn't want to anyway. And so when I'm working with somebody who is in a chronic pain state or in a PTSD state, I help them realize that going back to the pre-pain or the pre-trauma state is not an option. Okay. But if you imagine this scenario, it's actually pretty powerful. So we go from the ability to feel pain to something big happening, and we go into a chronic pain state. Did we really have to do anything to become rewired? No, we just
No.
had to participate. Yeah, the system is that powerful that it does it because that's the one thing that will keep us alive. Well, if it's that natural and that powerful, is it possible to take it from this state to something else? And the answer is yeah, of course it is. But what a lot of people do is they stop the process from beginning because they don't believe they can do it. Well, that's psychology and self-concordance. And if we don't believe we can do something, we'll create the conditions that make us right because we don't want to be wrong. So we'll self, kind of sabotage ourselves because that's better than knowing that we're actually the cause of our suffering.
Or isn't fear a part of that too?
Oh, it's
Aren't we
huge.
afraid to feel the pain again?
Oh, yeah, absolutely. And that's a beautiful thing because we don't like pain, but if you start to see pain as a friend to invite them into your life, you start to, I mean, there's lots of philosophers who've written that you usher in your fears, usher in your pains through the front door, sit down by the fire with them and get to know them because they're in your life. They're not going to go away.
Now,
So how do you change your relationship?
right, and from a brain standpoint, is pain just stimulation?
No, no, absolutely not.
Do you
So
know what I
there's,
mean? Like, is it just
yeah,
the
absolutely.
nervous system has been
Yeah.
stimulated and
So this is where the mind-body connection comes into play. Just like pain is never just a physical phenomenon. It's always a physical emotional phenomenon. So if you look up the definition of pain by the International Association for the Study of Pain, it is both simultaneously and always a physiological thing and a psychological thing. Because without one, like the physiological, you don't have the psychological. But if you remove the psychological, you can still have the physiological part of it. That's called nociception. That's the ability to sense trauma or something that's going to hurt you. That's pain, if you will, but pain and suffering are completely different entities. Because I'm an ultra marathoner. I did run over the course of weeks, 825 miles. Did I have intense pain? Well, I lost my first toenail after the second day. I'm running that much. I'm causing my toenails to fall off. I'm having aches and pains and all this other stuff. But that's my friend to help me go, how am I running? Do I need to change? Do I need to lean back? Do I need to go forward? Do I need to stretch? Do I need to? So pain is the most important friend I have. That is my success factor to get me to the finish line, not to stop me. But if I see it as pain, I'm going to stop. I will stop. Okay. So here's where the mind-body connection comes in, because in the guided meditation at the start, the worst thing we can do when we have a trauma happen, like the starter's gun or a cancer diagnosis or whatever it is to freak out and start doing things. Because in the meditation, I said, okay, you're in the race, the starter's gun got off. You don't know where you should run. So if you need to get to the finish line, just because everyone else is running that way doesn't mean you need to run that way. What if your finish line is over there? You're going to go a lot longer if you go down the other route. So things like denial, shutting down, just sitting on the couch and crying for weeks on end. Those are beautiful mechanisms to help us get through the trauma. And when we start to unpack the science behind post-traumatic growth, we realize that the people who eventually go down that growth route are the ones that take the time to breathe, to not run, to not, to sit with their emotions and go, according to the British vernacular, bloody hell, I didn't ask for this. I'm a good person. And
right?
that's why I wove that in there. Just because we're good people doesn't mean anything. Pain, trauma, physical lives, it's all. But that doesn't mean we shouldn't be good people.
Right, right, right. I was
Yeah.
just giggling because, and I was even smiling when, creativity is one of my top strengths. So I was like, oh, you're here. I was like, cool. I've never been here before. So I was like ready to go. And then I was like,
Mhm.
oh, but you can't do anything about it. And you're not quite sure where to go. And then I was like, Gary, you're not going to leave me here, are you?
No, yeah. So
But
I do want to.
yeah,
I'm looking at some of the questions here, and I love interacting with the chat
sure.
function
Yeah.
because there are some amazing questions in here, and one of them had to do kind of earlier on with psychedelics. And so this is a fantastic thing because I'm a neuropharmacologist, and psychedelics are one of these things that I go, this is so cool because of the reality that nothing, no medication creates function in the body. It only does what the body already does. It enhances or blocks what the body already does. Medications don't create function. So psychedelics are a beautiful example of something that helps the body get into a particular state, but the body does it naturally. And so, do we need to have psychedelics to actually take us to trippy states?
No,
No, we don't. We can go into these states unless I go into them in my runs. I really do.
I go into them with music.
Music, tantra. I mean, I don't care what it is. It's the body naturally does this. And so, but the point is do psychedelics have the potential to help us in ways that the body may not be able to do at that point? And the answer is yes, because unless you're ready to 100-mile run, the answer is you're not ready to 100 mile run a 100-mile run. But could you develop the capacity, the skills, all of that stuff to get you to that point? The answer is not in question, yes. Every single person on this call can run 100 miles, not even in question. But I can hear people going, oh, there's no way I could. And I'm like, you're correct. As long as you have that mindset, you will prove yourself correct, not even in question. If you go, wow, I'm curious about that. Hmm. If I were to do that, what would I need to do first to get me to the point where I could even try it? That's an open mindset. That's what Carol Dweck talks about. Don't shut it down, because if you shut it down by the I could never, you're right. And I'm not going to argue that. You're right. You will prove it. Doesn't mean it's true.
Going back to that 50% of the people that you could help, how
Yeah.
did their mindset affect that? Was it because they didn't believe they could be helped? Or
So
was it
this,
actually as you
yeah,
said, physical and psychological?
yeah. And so, so this is where I unfortunately moved on too quickly to try to unpack their particular issues. But what I did notice is that very similar to pain being a physical and emotional thing, there is never an experience we have in life that is not a mind-body experience. Okay. It's like when I'm speaking with physicians or researchers or whoever, anyone else kind of worldwide, and they start down the nature versus nurture debate. And I want to slap them. Not that I'm a violent person, but I like to slap them because there is no versus. We are all nature and nurture, period. And so I like to ask people, and I'll use you as the example because I asked you if I could do this with you earlier.
Sure.
So Caroline, when was your first traumatic experience? When did you first feel stress? How old were you?
Hmm. Young. I remember being at the top, climbing to the top of the closet when I
Ooh,
was little. I
nice.
was a climber, and then my parents going, ah!
Yep. Okay. So two, three, maybe,
Yeah,
because two is a
yeah,
little bit. Two.
yeah.
Okay. So what if I told you your first trauma actually happened before you existed? Would you believe me?
Well, what I know about epigenetics,
Here we go.
yes, I
Here
would.
we go. The stress of the mother and the stress of the father is carried into conception. Yep. Now,
Mm,
this is not to say that a stressed mother or father or a stress pregnancy equates to a flawed, scarred individual that can't live a life of thriving. It's not to say that. But our first trauma is carried in the sperm epigenetically from the father into the mother who has epigenetically changed her egg. Okay, so our nature versus nurture predated us.
Mm.
That's just a fact. Okay, and we go, okay, well, that's a fact. It just doesn't really mean anything, except it's not a nature versus nurture debate, and it's never a mind versus body debate. Never. And so in the description that you used early on that I wanted to talk about today, the inseparable nature of the mind and body, I'll just simply ask you, where does your brain sit? Not a tough question.
Here,
Up here. Where is that?
in my head,
Okay,
in
in your
my,
head. And is your head part of your body?
yes,
Okay, so is your brain separate from your body?
no.
That's called decapitation. Yes, yeah. Usually we keep them attached, right?
This
So,
is not a trick question.
not a trick question. It's pretty simple. And so here we go. So if we think that just by cultivating the mind that we will develop a life of thriving, that's like cultivating a beautiful flower, like an orchid or, something that's absolutely beautiful, brilliant, putting it into a pot that's full of rotting chicken. How long do you think this beautiful flower is going to flower and thrive in a
Not
pot
long.
of rotting chicken? Not long. Well, when we don't work on our physical health, our brain sits in basically a pot of rotting chicken. Now, if we only cultivate our body, what do you think is going to happen to the mind if we don't cultivate it?
Same thing.
Same
It's
thing.
going
It's going to
to,
atrophy. It's going
it's
to
not going to
atrophy. It's
atrophy.
not going to
Yeah.
work very well. And so I love yoga because yoga is a mind-body connection. It is physical movement, Nia, same thing. I mean, there's so many other types of practices that are out there that recognize that we have to cultivate both, not even in question. If we cultivate one at the expense of the other, something is going to break down, not even in question. And so the people who are not physically fit, I go, fantastic. So the people who used to come into my yoga studio, my holistic wellness center in Pennsylvania, they would be like, oh, I want to start yoga. This is a brand new year, new me. I'm ready to do yoga. And I'm like, oh, this is awesome. When was the last time you did 60 minutes of yoga? And they're like, oh, I've never done yoga. I'm like, good. You're not going to do 60 minutes today.
Right.
Period. Don't even try it. Well, but I want to get healthy. Cool. Don't do anything right off the bat. What are you eating? What are you fueling your body with? Your mind and your body. What are you putting into it? Because asking it to perform well before you actually fuel it properly is like trying to it's trying to use a muscle car putting vegetable oil in it. It's not going to work very well.
It reminds me of what you were saying about in the opening meditation. You know, don't start. Don't just get into action
Yes.
right
Yeah.
away. Like
Just
let's think about it.
sure.
Where's your finish line, and
Yeah.
how are you going to get there? And spending
Exactly.
that, the power of the pause.
The power of the pause. And this is where the power of the pause is so powerful, because we do not objectively assess our lives very well at all. And so even when we take the pause, it might make us feel good. But again, we would rather lie to ourselves than tell ourselves the truth, because it's sometimes too painful to think, I've been a real crank for years. I've been a real angry person for years. I probably have hurt numerous people in my life for years. That's a hard thing to come to. So we sugarcoat it. We don't do it with other people, but we do it with ourselves. And so even though we take the pause, that's just the start. The rest of this is unpacking all of the different layers in our life. And what I love about the Whole Being Institute and the positive psychology certification that Phoebe and I and a bunch of people have gone through is it recognizes that we are living multiple lives simultaneously that all need to be cultivated. And so in the Whole Being construct, there's the acronym SPIRE, S-P-I-R-E. And for those people who are on the line who don't know that, it's to recognize the spiritual, physical, intellectual, relational, and emotional lives that we live. And I like to use this as a recognition because I like to talk about pain and pain management. Well, pain seems to be a physical thing, okay? But we've already talked about it not just being a physical thing, okay? But if somebody's in pain, they commonly turn to medicine to treat the pain. They go to a doctor. The doctor says, I want to treat your pain. Here's the medicine. Well, that's a physical issue trying to be dealt with physical, measures, which is fine. There's nothing wrong with that. But what if the cause of your pain is because your relationships are crap, your emotions are completely out of whack, and you're feeling spiritually disassociated from your maker, from the greatness that is around us? Wouldn't it be better to cultivate the spiritual, the relational, and the emotional parts of your life? Because guess what? If you do that, most oftentimes the physical pain will lessen, if not go away. Now, when you need stuff like medicine to help it along, that's like asking somebody to exercise a little bit more on the backdrop of a good diet, on the backdrop of relaxation and meditation. It's never at the expense of something else. It's what is the right combination of things to weave in so that we're brought back into holistic wellness, and it has to be holistic. The other way of looking at this, and then I'll kind of stop because I think there's some other good questions here, is people who go to church or synagogue on a Saturday or a Sunday for a couple hours and then live the rest of their week angry and not so spiritual, if we will, don't really have a good spiritual life. It's not a really good spiritual foundation, right? And that's like somebody eating one good meal a week and going, boy, I feel healthy. I had that, and then going back for the rest of the week and eating crap food. Our spiritual lives, physical lives, intellectual lives, the whole part aspire, must be cultivated on a daily basis, period. And so if somebody comes in and I'm working with them, the first thing I do is I go through this and have them track all 5 of these over the course of a month. Because it varies. Sometimes we're feeling disconnected. Sometimes we're doing great stuff. Sometimes our emotions are not so great. Those are those daily fluctuations. If we only look at one snapshot in time, we may be misled of what the actual backdrop is. And so just measure them. Don't judge them. Just simply try to measure them and then start to see that, wow, when I have a fight with my spouse, 2 days later, I have a raging headache or my knee hurts or whatever it is. And it's like, there may be a correlation between the two. Maybe not causation, but if there's a correlation, maybe you can start to relieve your pains and your physical issues by cultivating a relationship instead. So this is where we start to get into all the different things. And so what does the I stand for? Inspire. Oh, so it's the intellectual.
Yeah.
We are by nature curious learners. Ask any kid, they're a curious learner. And so the intellectual just simply says, it doesn't matter if you're quote unquote educated, smart, you are. You're a curious monkey. All of us are. And that's a beautiful thing. So it's all about intellectual learning.
Well, that's what I loved what you said, and I'm so glad you linked it back to curiosity, because my understanding of when we get curious, we like activate the learning centers, we get, the memory going, we get everything that's going to help us, not to mention, and we haven't talked about really love, but my understanding is if you want to learn anything or teach anyone anything, if they love it, they're going to learn it in a different way. It's going to be implanted in the brain in a different way. And one of the most important things that we can do is to, if we're teaching anybody anything, is to imbue that sense of loving what we do.
First thing we need to do as educators is scrap everything else and go straight to the person and say, what lights you up? What are you really, what really makes your heart sing? Because the E, just to let you know, oh yeah, thank you, Phoebe, for answering. The E is emotions. Emotions come into play in learning in spades. Because if we're bored with something, if we don't feel like we want to learn it and somebody's trying to force it into our system says no thank you. It's just like it's rejecting a bad food, rejecting a medicine. We will put up defense mechanisms and we will not learn it. Not even in question. However, emotions are also a biphasic type of stimulus. And so if we're not stimulated at all, we don't learn. We go up to a peak, and then if we're stimulated too much, we don't learn. And so passion is actually one of these things that we have to be careful. with, because we call them crimes of passion for reasons. Because when we're passionate, truly passionate about something, we're stupid. Our passion takes over, and we commit crimes. And so just because we're passionate about something doesn't mean we're in the clear. We need to look at it and go, oops,
Temperance.
maybe I'm a little bit too much. Exactly. I need to kind of calm things down. And it's the same thing with physicality, So we have to be interested in something that gets us moving, if you will. If we're exercising to become healthy, we're doing it backwards. Healthy bodies are an outcome of a healthy life. Exercise does not get you there. Exercise will help fine tune you, but exercise does not create a healthy life. A healthy life creates a healthy life.
Yeah.
But if you have to enjoy it, you have to enjoy what you're doing. And so,
right.
yeah.
I actually use my exercise, and I have like a calisthenic weight workout that I do 3 times a week. But what I find it does is it helps me train my mind, because, when I do 3 sets of whatever I'm doing, there's a part of me that doesn't believe that I can do it.
Yeah. Oh, yeah.
And of course I can do it. And so I get to watch that interaction that I think you're talking about. Like, oh my gosh, how long? I'm doing this for a minute. How long is that? And it's the same conversation that comes up. And then I get to say, breathe.
Yeah.
It's almost over. You can do it. I even do things like, you're so strong, you're so brave, whatever, to pass that time. And that feels to me like what I'm doing, what you're talking about, is like working in relationship, getting curious about my own neurobiology, tracking how I do what I do, tracking the conversations, whether negative or positive, that either spur me on or take me down. And then being the one that's willing to say, wait a second, where do I want to go? Why do I want to do this? And, hooking in meaning into that. And then these small incremental things, having those habits that we talk about in our positive psychology toolbox, that are just daily ways of how can I show up in the face of what I would call grounded optimism, in the face of some, let's say that cancer diagnosis or whatever. It's like, okay, that happens. And the power of the and, as humans, what I hear you saying, we are designed to thrive, not just survive in those situations. But we have to know that, first of all. We have to know that post-traumatic growth is possible.
Possible. Yep.
Right? We have to know that we could actually thrive during COVID.
Yep.
Maybe you're the first person that has said that.
So here's there's a beautiful question by Christine, I think, right here, that's related to Maslow's hierarchy of needs. And so this all fits in. And so when we have the most basic needs unmet, it's very difficult to start to address those higher needs. But the question to me is what are our highest needs? Seriously, what are our highest needs, And Maslow's hierarchy was a good structure that has been proven to be true in some studies, not been supported in other studies. It doesn't matter if it's right or wrong. It doesn't really matter. It's, what are my needs? What are my needs in this moment? Because what I needed yesterday may be much different than what I need today. And so everything in our world is transient. So to get into Buddhist philosophies, nothing is permanent, period. And so we need to revisit every single thing in every single moment to go, okay, what are my needs right now? I always need to feel like I'm going to survive. That's the biggest overriding thing, because if that's not met, it doesn't matter what else is going on in our lives. That threat is what I research, and that wipes everything off to the side. It clears the table and says, nope, you need to focus on this. But once you start to get that settled, then it's like, what do I need? Well, Maslow's hierarchy is a little bit too rigid to me, because in some moments we really may need to feel that intense connection with somebody to make us work in a particular way. We don't have to have all the other needs met in that moment. Matter of fact, that's the point, is we can suspend what we think was so critical to our own well-being momentarily. If we understand that it's really not that important. Do I really need a chocolate bar right now? The answer for me, yes, is always yes. But because I'm a chocoholic, but chocolate only has calories if you believe. I'm a pharmacist, trust me on that one. But it's can we just simply be flexible and suspend our belief systems while we explore the potential? And this is where learning comes in, because learning is a lot like habits. And somebody asked a question I think earlier about habits. Habits and learning and behaviors are all simple in some ways, neurochemistry. So everything that you do physiologically and every single thing that you think, every single thing that you believe is because of the architecture that you have crafted in your particular mind, in your brain. That can be modified. Now imagine this though. To modify that is like being on a propeller plane, in the air, and going, gee, I'd really like to be on a jet right now. And you go, okay, how do I do that mid-flight? So what we're asking the mind and body to do mid-flight is to change that from a propeller plane to a jet. And most people would go, that's not possible. And I say, sure it is. Absolutely it is. How would you do it? You would have to replace tiny little parts, tiny little parts, tiny little parts. You'd have to think through this though first. Because if you tried to change too many things too quickly, the plane crashes. But is it possible to change a propeller plane into a jet fighter mid-flight? The answer is yes. That's actually easier than rewiring the brain, because the brain has as many neurons as there are stars in the Milky Way, 100 billion. Each has 10,000 synapses. So we're talking trillions of synapses. Every single one of them work on a microscopic level, and they're all changing every single day.
It's amazing.
It's amazing
Neuroplasticity.
we're actually functioning.
Right. I
But we
also want
did.
to make sure that I ask you this question because I know we're getting close. We only have like
Sure.
8 minutes left. But it feels to me like to go back to that first meditation and, like trauma is going to happen is essentially what you were saying. And
Yeah.
yet then we also create inner trauma. Like with perfectionism, with I'm not
Oh,
good
yeah.
enough, with all of these kind of
Yeah.
things. Is that
Yeah.
in some crazy way the brain's wanting to keep us safe too? All that internal stuff that we do?
Yeah. Yeah. So because we are nature versus nurture, even before we're born, right? But it continues on after we're born. And so we know that our worldviews are set before we're 7. So how we actually see ourselves in the world, we don't understand it at all. Matter of fact, the brain isn't fully formed ever, really, but by the grossest measures, the human brain is continuing to develop into age 25. It really never stops, which is a beautiful thing and a traumatic thing. But anyway, how we see the world is actually set before we even understand how the world works. Okay. So things like perfectionism were probably implanted into our system, our mind body system, our belief structure before we understood even what perfectionism means. Okay. So that was because we saw how, when we did this, mommy responded in this way, daddy responded in this way, whatever it was, that there was some kind of beautiful link that was established very early on. Those links will never go away. Okay. What we can do is we can recognize those links for the positive that they were and slightly modify them so that they're not the crutch today. So, crutches can help us move when we're wounded, if you will, but crutches later on when we're healed are still crutches. It's kind of taking us away from what we could do. So what we do is, so the way the brain is organized is in what's called an architectural matrix. Okay, so when we think of one thing, we light up entire areas of the brain. Okay, even just a single concept. We can rewire that up until the day we die. Neuroplasticity never stops. Matter of fact, we've got stem cells that we didn't think existed in the brain that are there. For those of you ladies who have had babies, there's a good chance that your fetus within you had a stem cell break apart, go through all of the barriers, including the blood-brain barrier, and plant in your head. Fetal stem cells exist in maternal brains. We don't know what they do, but they're there. And so we've got this potential to continue learning up until the day we die. But what happens is we normally keep pressing it, pushing it, compromising it over the course of our 30s, 40s, 50s, so that the system is very compromised when we enter into our 60s and 70s and 80s. Well, I'm 54 and I am running ultra marathons, not because I'm some kind of super athlete. It's because I had somebody a decade ago named Tal Ben Shahar go, what do you think is possible? What scares you when you hear it at the start, and then could you do it? So my 100-mile run was not because I'm an ultra marathoner. It's because Tal said, what do you think you could do? How would you do it? And I'm like, I don't know. And so that 100-miler turned into 215 miles, which turned into 825 over time. And because I just simply had a curiosity. So I would just simply offer up to everyone here, what are you curious about? What do you immediately hear where your first reaction is, there's no way I could do this? And then go, I wonder if I could. How would I do it? How would I go about it? How would I start to, talk with other people to go, how did you do yours? Open mindset, gathering up information, being creative, and also being infinitely patient with ourselves first and with others secondly. Because it takes a long time to do this stuff. It's not fast, but it certainly is fun.
You said one of my most favorite words, especially in relationship to the brain, which is wonder. I wonder how I would do it. My understanding from a brain chemistry point of view, the ability to wonder it's like food for the brain.
Yep.
It's like
And all of this, it's nourishment, but it can be. So there's one other question about overwhelm. And so all of this can be completely overwhelming if we allow it to be. If we just simply go, hold on a second, that's too much. Oh, that's wonderful. That's like being in the starter, after the starter's gun goes off, and instead of running, just going, no, I don't think so. I'm not ready to do that yet. I need to take stock of where I am. And so we just simply go, I don't need to act. I don't need to do anything heroic now. I just simply need to sit and warm up and go, okay, what can I do in this moment that just subtly and gently starts to influence my baseline? Just do it slowly and then start to see the positives that start to happen. And then you go, okay, it still is going to be a long haul, but maybe I can do this. If things start going south, you just got to take a step back and go, okay, that was fun. I learned a lot. And then keep going. So none of this is necessarily speedy. It shouldn't be, because that's resilience. Resilience is not allowing things to change us dramatically in the moment. It's also not necessarily overwhelming unless we allow it to be, but there's a lot of things going on. The biggest thing is getting back to, I think, what you said, and that's the enjoyment factor. If what you're doing is not fun, if you don't giggle while you're doing it, you should stop doing what you're doing. You will not continue on for long. Always bring the giggle into it, because if you're not enjoying it, it's not quite right now. It might be right later, but it's not right now.
Well, Gary, wow, this has just been amazing. It reminds me of the brilliance of the power of the pause, taking it in the and, that we, as humans, we have a huge potential. We can make a plane into a jet as it's flying, right? And by doing that incrementally and wondering and being curious as we go and loving and having fun while we're doing it and being patient and not expecting that to happen overnight, we can actually grow towards a fuller spire, right? Human. Is that, have I summarized
And you got
that?
it. And the more we cultivate this in ourselves, the more we can help cultivate it in others. That's leadership. Leadership is not dictatorial, disempowering people. It's, how do I work best with you? How do we develop a relationship so that I help you cultivate your own environment so that you thrive? That's leadership.
Beautiful.
That's what I get to do here in the UK.
Well, we miss you, and sounds like you're needed here too, but I'm glad you're on this call and you've been able to give us so much information, so much food for thought.
Such a joy.
I really understand that terminology, food for thought. I feel like I've just been given food that I can chew on. And I know that Phoebe's on the call. Phoebe, we have who do we have on Thursday that's coming?
We have a New Yorker who's now in California, Jean Campbell. She's a licensed clinical social worker and also, like myself, a trainer of psychodrama and group psychotherapy. She is a graduate of the SIP program, so she's a positive psychologist. She's also trained by Peter Levine's group in somatic experiencing. So she's going to teach us about somatic resilience. As Gary was saying, these incremental tools that we can apply on a daily basis to help you with this time as we are all in this together. And again, Gary, thank you so much. It's been quite a while since I've seen you, and I just think that so much of what you brought today will be used and utilized, and I'd love seeing you and Caroline dance in this conversation.
I would offer up, if anyone has any other questions, absolutely just please reach out to me. I'm on LinkedIn, or however they want to reach me. I'd love conversations like this, because this is what life is all about. It's just networking is beautiful.
Awesome. Well, thank you. And everyone, thank you for joining us. If you have, again, more questions, please let us know what it is, what they are, and we'll see if we can answer them. Take care, everybody. We'll see you next time.
Thank you, Gary.
Thank you, Gary.